How is IBS diagnosed? Have you ever wondered how healthcare professionals determine if someone has irritable bowel syndrome? The process is quite interesting and involves several steps. First, it begins with a detailed discussion about symptoms and medical history. There is no single test for irritable bowel syndrome. Instead, doctors look for specific patterns in symptoms and rule out other possible conditions. When you visit a healthcare provider, they will ask about abdominal pain or discomfort. This pain should occur at least 1 day per week over the last 3 months, with symptoms starting at least 6 months ago. Along with this pain, 2 or more additional symptoms must be present. These can include pain related to bowel movements, changes in how often you go to the bathroom, or changes in the appearance or consistency of your stool. This approach aligns with the Rome for criteria, which are widely accepted standards for diagnosing irritable bowel syndrome. Healthcare providers will also ask about any other symptoms that might indicate more serious issues. These include unexplained weight loss, rectal bleeding, fever, anemia, or symptoms that began after the age of 50. If any of these alarming symptoms are present, further testing is necessary to rule out conditions like inflammatory bowel disease or celiac disease. A physical examination is also part of the process. The doctor will check your abdomen for bloating, tenderness, or unusual sounds. Blood tests and stool tests may be ordered to exclude infections, inflammation, or other gastrointestinal disorders. Some newer blood tests can detect antibodies linked to irritable bowel syndrome, especially for diarrhea-predominant or mixed-type irritable bowel syndrome. However, these tests are not definitive on their own. Imaging tests such as X-rays or computed tomography scans are not used to diagnose irritable bowel syndrome directly. However, they may be performed to rule out other causes if initial tests suggest alternative diagnoses. Understanding how irritable bowel syndrome is diagnosed is important, especially when considering gut health and food-based recovery. The symptoms often relate to the gut-brain axis, where diet and stress can significantly influence digestive function. Once a diagnosis is made, dietary changes can be tailored to help manage symptoms. This may include increasing fiber intake, avoiding trigger foods, or following a low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols diet. These adjustments can support gut healing and improve overall health. In summary, the diagnosis of irritable bowel syndrome relies on identifying symptom patterns, excluding other diseases, and conducting a thorough clinical evaluation. After diagnosis, diet and lifestyle changes play an essential role in managing the condition effectively.